Hi, I'm Bob Weedon, a high quality, high volume surgeon and a member of the board of directors of the Alliance for Contraception in Cats and Dogs. Animal population control is a passion of mine, but so is rabies prevention. Incorporating the two in dog and cat population management programs not only has the potential to save lives, it engages a whole new set of stakeholders, the public health community, in support of these programs. So here's what we're going to discuss today: a quick overview of rabies and its public health impact, some of the challenges facing vaccination at the time of sterilization, a brief introduction to TNVR, Trap, Neuter, Vaccinate, Return programs, rabies vaccination protocol in kittens with emphasis on the effectiveness of rabies vaccination in kittens less than 12 weeks old. Rabies is a viral zoonotic disease primarily transmitted through the saliva of infected mammals via bites or scratches. Globally, the disease causes an estimated 59,000 to 70,000 human deaths annually, predominantly in Asia and Africa, with dogs being the main reservoirs. In the United States, wildlife species such as bats and raccoons, foxes, and skunks contribute to regional transmission, but in other parts of the world, domestic animals, mainly dogs, remain critical in the transmission cycle. Surveillance data show that controlling rabies in animal reservoirs, including free roaming dogs and cats, is essential to prevent human cases. Once clinical symptoms appear, rabies is almost always invariably fatal in humans and animals, making prevention critical. The disease causes acute encephalitis, leading to paralysis and death. Economic impacts include the cost of post-exposure prophylaxis for humans, animal control measures, and loss of livestock. The World Health Organization estimates that post-exposure prophylaxis saves tens of thousands of human lives annually, but is costly and challenging to access in resource-limited areas, underscoring the need for effective animal vaccination programs. Community animals, such as free roaming and feral cats and dogs, serve as significant reservoirs for rabies in many urban and peri-urban areas. Controlling rabies in these populations through vaccination disrupts the transmission chain, protecting human populations and wildlife. Studies indicate that maintaining vaccination coverage of at least 70% in these animals is critical to achieving herd immunity. Failure to control rabies in community animals contributes to outbreaks and increased human exposure risk. Implementing humane population control measures, such as sterilization, and raising awareness about rabies prevention, both support long-term rabies control efforts. But there are challenges that programs face when it comes to vaccination at the time of sterilization. The first is the fact that many veterinarians hold the outdated belief that vaccination should not be performed at the time of surgery. We will debunk this myth in this presentation. An additional challenge with respect to TNVR programs, and likely dog population management programs as well, is the management of young animals that are frequently trapped before reaching the recommended age for rabies vaccination. In situations where organizational resources are limited, these puppies and kittens often cannot be diverted to foster care for socialization and adoption, and are therefore vaccinated and returned to their colonies. This practice raises the question of whether vaccinating puppies and kittens under the age of 12 weeks is effective in inducing protective immunity against rabies virus. I will present published peer-reviewed data that demonstrates that kittens vaccinated under those conditions have an excellent immune response to rabies vaccine, and if these kittens cannot be diverted to foster care for later vaccination, the practice should be encouraged. And there's published evidence in support of the fact that vaccination at the time of neutering is effective. Fisher et al. Published an article in JAVMA entitled responsive feral cats to vaccination at the time of neutering. This article showed that prior to vaccination, some cats had protective serum antibody titers, but only 3% of them had antibodies to rabies virus. Notably, following vaccination for rabies, 98% of the cats had protective serum antiviral antibody titers. Another article by Reese et al., published in JAMA in 2008, entitled Effects of Anesthesia and Surgery on Serologic Responses to Vaccination in Kittens, concluded that neutering at or near the time of first vaccination did not impair antibody responses in kittens. And finally, this article, published in the journal Vaccines in 2023, looked at rabies vaccination of dogs while undergoing sterilization, and they included, quote, perioperative administration of rabies vaccine in dogs undergoing surgical sterilization induces an adequate antibody response. We recommend that rabies vaccine be administered perioperatively during spay-neuter campaigns in canine rabies endemic areas if other opportunities to access veterinary care and rabies vaccination are limited. You are likely aware of TNR, Trap Neuter Return programs, but I would advocate for the acronym TNVR, Trap Neuter Vaccinate Return, because that promotes the fact that we are vaccinating these cats against rabies, and in doing so, we create a barrier to the disease between wildlife and domestic pets and people. In the U.S., TNVR programs aim to humanely reduce feral cat populations and prevent disease transmission through trapping unowned cats, sterilizing them to prevent reproduction, vaccinating against diseases such as rabies, and returning them to their environment. The process helps stabilize cat population, reduces nuisance behaviors, and interrupts disease spread. An additional component of some programs is monitoring, providing the cats with resources, reduces predation, and ensures population stability. Also, any injured or unwell cats can be trapped for medical assessment. Data show that communities utilizing TNVR achieve population stabilization within 2 to 3 years, improving both animal welfare and public health outcomes. In a study published in the Veterinary Journal in 2014, Levy et al. Reported that high-impact TNVR, combined with adoption of socialized cats and nuisance resolution counseling for residents, is an effective tool for reducing shelter cat intake. As you can see from these graphs, annual per capita community cat TNVR surgeries in the target area increased significantly during the 2 study years, years 1 and 2. This was accompanied by a significant decrease in shelter cat intake and euthanasia. In the non-target area B, annual TNVR surgeries remained at a baseline rate, and shelter cat intake and euthanasia did not change significantly. Per capita results are reported as cats per 1,000 residents, and the asterisk is interpreted as significantly different than the mean plus or minus 2 standard deviations of the 5 pretreatment years. Recall this previous slide, where notably following vaccination for rabies, 98% of the cats had protective serum antibody titers. So what about kittens and puppies that aren't of the minimum label age, 12 weeks, for rabies vaccination? Young kittens less than 12 weeks of age present challenges. Ideally, they should be diverted to foster care for socialization and eventual adoption. However, if organizational resources do not exist to provide that, then they are vaccinated and returned to the colony. The question is the practice effective? Well, we now know that it is. In October 2025, my co-authors Peter Wolf and Sue Neal and I published this paper, Response to Rabies Vaccine in Kittens Under 12 Weeks of Age, in the Journal of Shelter Medicine and Community Animal Health. We performed a prospective pilot study of 10 kittens less than 12 weeks old to assess the effectiveness of rabies vaccine. One of the criticisms by those opposed to TNVR programs is that there's no evidence that vaccinating kittens less than 12 weeks of age is effective. You know what? They were right. There hasn't been any peer-reviewed data to demonstrate efficacy until now. We recently completed a pilot study where 10 kittens less than 12 weeks of age were vaccinated for rabies. We drew blood for rabies titers pre-vaccination, and none of them had detectable antibody levels. All 10 kittens were sterilized and vaccinated for rabies. We repeated the titers 28 days after vaccination. All of them had titers significantly above the 0.5 international unit per milliliter level considered protective. The average was 8.8 international units per milliliter, and the range was 1.9 to greater than 13. These results were recently published in the Journal of Shelter Medicine and Community Animal Health. Our conclusion was that vaccinating these kittens is indeed effective, given the fact that this may be the only rabies vaccine that kitten ever receives. The practice should be encouraged. There's very limited peer-reviewed data on the efficacy of vaccinating puppies younger than the label age of 12 weeks for rabies. However, according to the World Health Organization expert consultation on rabies published in 2018, it states, quote, during mass vaccination campaigns, all dogs should be vaccinated, including newborn puppies, regardless of weight, state of health, or prior vaccination. And in a paper in the Veterinary Record, Mortars et al. Report in rabies endemic regions, a proportionally higher incidence of rabies is often reported in dogs younger than 12 months of age, which would include puppies less than 3 months of age. This presents a serious risk to public health. The higher incidence of rabies in young dogs may be the effect of low vaccination coverage in this age class, particularly as a result of the perception that immune systems are immature and maternal antibodies inhibit seroconversions. Therefore, to test this perception, the authors reported on virus-neutralizing antibody titers from 27 dogs that were vaccinated with rabies vaccine, aged 3 months of age and younger. All dogs seroconverted with a single dose of vaccine with no adverse reactions reported, and post-vaccinal peak titers ranged from 2 international units per milliliter to 90.5. In light of these results and the risk of human beings contracting rabies from close contact with puppies, the authors recommend that all dogs in rabies endemic regions, including those less than 3 months of age, are vaccinated with high-quality inactivated vaccine. So in conclusion, TNVR programs not only help reduce the population of animals, they improve the health and welfare of individual cats. They protect the health of the public by creating a barrier to rabies between wildlife and domestic pets and people. And by doing so, we engage a whole separate group of stakeholders, the public health community, in support of our efforts. So now, I will entertain questions.